Hi everybody, I'm Gregory Drambour, owner of Sedona Sacred Journeys, spiritual retreat organization here in Sedona. Welcome to a very special video called The Plea. This is a video I've been trying to make for about 4 or 5 months now. I think I'm putting a little pressure on myself. I'm not following my own advice to clients, which is progress, not perfection. It's an important video, and it has to do with the probabilities of getting cancer. It has to do with the mind-body connection. About 3 or 4 months ago, I lost a very special client. Her name was Ivana, and I know that she would have wanted me to make this video. Right now, the research says that for women between the ages of 42 and 50, 1 out of 2 women will get cancer. So this plea goes out to them and all of us. You know, what can we do to prevent that from happening? Are there actions we can take? Absolutely. And I'm going to outline maybe 5 of them here. Now, if it's on YouTube, you'll find it on this description, and if it's on my site, you'll find it right underneath this video, and some links to follow up on. And I encourage you with all my heart to please do that. If these are the statistics, you know, why don't we do something, right? Why don't we get proactive about this? It's not complicated. These actions that I'm going to suggest that you take, guys, are not expensive, are not time-consuming. So I really want you to think about it and hear some of the things I have to say in this video. So the first one is to get on a world-class, cutting-edge alternative protocol, especially if you have a family history of cancer, as I did. When I had cancer, my cancer herbalist was a fellow by the name of Donald Jantz, who has an organization in Ashland, Oregon. I've sent many people to him. It dawned on me that if he is one of the leading experts in herbalism and cancer, then why couldn't I send people there who perhaps are at a risk of it to prevent it, to create a preventative program, a maintenance program. So I'm going to leave a link here for you. Now, one of the cautions that I want to put out to everybody is be very careful of self-prescribing. Let's say if you do have a family history of cancer, you know, and doing some reading and some research with the internet, that's so easy these days, and finding a list of herbs to keep your immune system up. I wouldn't do that, guys. I would spend the money on a consultation, whether it's with that organization or somebody else, but find somebody that has experience with cancer, because that only makes sense to me. And find a budget that's good for you on a monthly basis, that you're comfortable with, and have them design a very customized, unique program for you. That's the first step. The second step has to do with cellular memory. Now, that's my area of specialty here in Sedona, is identifying what, if I'm working with a cancer survivor or patient, is what is the possible emotional contributor or cellular memory to getting that disease. So in working with all sorts of clients, ones that don't have chronic illnesses, I've discovered that, and this is really in partnership with them, that they have what I call a strategy for illness. So I want to try to help them to prevent that from happening. You know, sometimes what I say is, does the bad thing have to happen to us for us to finally make a change? So this is about deep cellular memory work. Most people get cancer or serious diseases from a lack of forgiveness of oneself or somebody else at the adult or the inner child level. And that can also transpose into codependency, which could be the fear of a lack of forgiveness or a fear of feeling guilty. My best recommendation on that is a modality called The Journey, developed by Brandon Bays. And so I would recommend getting that book. And there are practitioners all over the country, and there are workshops being given all over the country. You will also find a link to my story when I went and did the journey and cleared out that cellular memory. It was about when I was 2 years old. The third recommendation I have is something I call the petition to divinity, or please substitute whatever word feels comfortable to you. And I'm going to leave a link to that, and there's also another video. This is kind of a way of asking divinity to transmute any and all programs or thoughts or imprints or memories that you're having that could show up as a disease. It's allowing divinity to discern what that is and clear it from you. The fourth step is I have found in my practice over the last 26 years is that people who have a chronic illness usually have a tendency to embrace a lot of unhealthy, unproductive, or negative thinking. Now, one of the things that we'll explore on retreat is what that person's definition for negative thinking and what my definition might be completely different. So we need to expand out our criteria for what that means. My recommendation on that is a book called Somebody Should Have Told Us by a colleague and very good friend of mine, Dr. Jack Pransky. It is the definitive book on what I teach out here, which at its core is realizing through an insight as opposed to intellectually that our thoughts create our reality moment to moment. And I'm going to allow that book to explain that deeper, but that is a solid recommendation that I think will help you shift that thinking that you walk around with, and that tends to keep you in a down place. And that has all sorts of degrees. Sometimes it's very subtle and we don't even know we're there. The fourth recommendation, of course, is diet. There are lots of wonderful diets out there, and you need to find one that you're comfortable with, or one the herbalist or naturopath or MD, alternative MD that you might work with might recommend that's appropriate for you. And it's certainly another recommendation is exercise. And finding exercise that you can get motivated to do, that you're not going to have any resistance. And if you have a little resistance, that's okay. Just work your way through it. Everybody, there are proactive ways that we can combat these frightening statistics that are out there around cancer. Back 20 years ago, 10 years ago, for somebody to get cancer it almost felt like an anomaly. You know, when I was growing up, if somebody down the block had cancer, we were all sort of like horrified, right? And it was just, and then now, in any neighborhood, in any American town, my goodness, how many people on that street have had cancer? It just seems to be an epidemic, and that's actually a quote from an oncologist that I'm friends with. He said, Greg, it's an epidemic. So this is about doing something about it. This is my plea to everybody. I hope this is helpful, guys. If you'd like more information, feel free to email me or call or set up a phone consult or come out here on retreat. I'm here. I'm totally at your service. Thank you for listening on this beautiful day here in the Magic Kingdom. Take care, everybody. God bless.